I've gotten a fair amount of texts. I just saw you on the billboard. I'm like, thank you very, very much. I can't say I'm comfortable, being in the spotlight. Parents didn't really have any money, so how to pay for college was a bit of a trick. I got into the Navy via ROTC and deployed overseas. As much as I enjoyed the romanticism of being out to sea, I had always, as a kid, had an interest in medicine. One way to do that was actually to teach as a instructor at a Navy ROTC facility. So I did that here at University of New Mexico and came here in 1995. So I've been here ever since. School of Medicine is really unique. Their curriculum of involving tutorials and early experience in a clinic setting became a model for other school of medicines to come and learn how we were doing it. You're around professors who love what they're doing. They want you to succeed. They want you to learn. They want you to kind of push yourself. But we're very, very lucky doctors and nurses and healthcare people to be in a privileged position to be able to take care of somebody, to try to make their life better so they can go out and do what they want to do.